The next step in your journey is the completion of the Missouri Bariatric Services Patient Information Packet. Inside is an orange sheet that lists all the forms in the packet that need to be completed before you make your first office appointment. They include medical history, nutritional history, personal information, the latex allergy questionnaire, and the primary care physician referral form. You may complete all the forms except the primary care physician referral form. It must be completed by your primary care physician. Once all forms are complete, you will be ready for your first office appointment. To schedule it, please call our clinic. You will speak to one of our patient service representatives who will discuss the process and schedule your appointment. You must bring all completed forms from the checklist in your patient information packet to your first office visit. Please do not fax or mail any paperwork to us. If you do not have your forms completed and with you, we will have to reschedule your appointment. Also included in your new patient packet is a map to the Missouri Bariatric Services Clinic. Please note our clinic is not located at University Hospital. At your first clinic visit, you will see our bariatrician, Dr. Kevin Suttmiller. He will help ensure you are the safest possible candidate for surgery and also help you meet the needs of your insurance company. During your first appointment, Dr. Suttmiller will discuss what diagnostic tests you need before surgery. Depending on your health status, these may include an EGD, upper GI, CAT scan, cardiac stress test, ultrasound test of your legs and/or abdomen, a sleep study, and a pulmonary function test. You may have these done at University Hospital or at your local hospital. If you prefer your local hospital, your primary care doctor will need to order these tests for you, and the results will need to be faxed to our clinic. If you wish to have them done at University Hospital, we will be happy to order them for you, and the results will be sent to our clinic automatically. If we request a test you had within the last year, please bring a copy of the results to your next clinic appointment. We will need to receive the test results to clear you for surgery and submit the information to your insurance company for approval. It is of the utmost importance that you are mentally prepared for the surgery you are about to receive. Missouri Bariatric Services and most insurance companies require a psychological evaluation before your surgery. The evaluation must be performed by a licensed psychologist or psychiatrist. It cannot be completed by a caseworker or social worker. Included in your new patient packet is a green sheet, which lists the specific information that needs to be addressed during your evaluation. Please share this form with your psychologist or psychiatrist at the beginning of your appointment. No mental health diagnosis will automatically exclude you from having surgery. However, failure to mention your mental health history to the psychologist or psychiatrist conducting your evaluation may result in removal from our program. We request your honesty so that we can treat you to the best of our ability. After your initial clinic visit and psychological evaluation, the next step is submission of your information to your insurance company for approval to have surgery. Missouri Bariatric Services staff will submit the paperwork called a letter of predetermination. Please do not try to send this letter yourself. It must be sent from Missouri Bariatric Services. We will send you written notification when your letter is submitted. Please be aware that every insurance company is different, so the requirements for surgical approval vary. In some cases, 6 months of medically supervised weight loss may be required, or a long history of non-medical weight loss attempts, such as Weight Watchers, will need to be submitted. This is why it is very important for you to contact your insurance company before your first clinic appointment to make sure you have completed all requirements. Typically, it takes 2 to 3 weeks for the insurance company to approve or deny your surgery. Most often, they will contact you before they contact Missouri Bariatric Services. If you wish to check on the status of your request for surgery, we encourage you to call your insurance company. After we receive approval from them, our office staff will contact you. If your insurance company denies your request for surgery, our office will notify you by mail. If you have been denied because of a lack of documentation or requirements have not been met, our office staff will do everything we can to ensure that these requirements are fulfilled and then resubmit your request for surgery. However, if you are denied because your insurance company does not cover bariatric surgery, our clinic will not be able to appeal the denial. We will be happy to make recommendations on how to navigate insurance appeals. Once your insurance company gives approval and our team clears you for surgery, we will schedule the procedure. Our staff will call you to schedule the following required classes and appointments. The first is a pre-surgery educational class, which is held in the Missouri Bariatric Services Clinic and lasts about 4 hours. It covers what to expect in the hospital, your surgery, and your after-surgery diet, as well as what to do if a complication arises and you cannot get to Columbia. Also, this is an opportunity to ask questions of our nurses and dietitian. Second will be your pre-surgery appointment with one of our surgeons. During this time, you may discuss any last-minute questions or concerns, review your test results, and discuss the risks and benefits of the surgery. Typically, your pre-surgery appointment will take place at our clinic the same day as your pre-surgery educational class. Your participation and attention at the pre-surgery class and pre-surgery appointment is extremely important. If for any reason during these classes we feel that for your safety you are not a good candidate for weight loss, your surgery may be rescheduled. Your final required appointment will take place at University Hospital with a member of our anesthesiology group to discuss and ask questions regarding anesthesia. Also, you'll have your last pre-surgery tests, including an EKG, a chest X-ray, and blood labs to make absolutely sure you are physically safe for surgery. Adjustable gastric band surgery is one of the procedures performed by surgeons at Missouri Bariatric Services. A typical stomach is the size of a football, so you would need to eat quite a bit of food to fill this space and send a sense of fullness to your brain. During the surgery, a prosthetic device is placed around your stomach to create a small pouch, thus enabling you to eat a smaller amount of food to feel full. Eventually, the food from the small pouch empties into the rest of your stomach and then your GI tract, which has not been altered in any way. Surgeons at Missouri Bariatric Services attempt to do all surgeries laparoscopically. As you can see in the video, the band is positioned around the stomach. You can also see the placement of the port, which is where we insert saline into the adjustable silicone band. The procedure takes the least amount of time to perform, and most patients go home the same day or the next day. On average, total weight loss for this procedure is around 40% of your excess weight. However, the procedure will not result in long-term weight loss if you do not receive the necessary band adjustments after surgery. These adjustments must be made by medical personnel. If you cannot make regular appointments to our facility for adjustments, please consider whether this surgery is right for you. Our surgeons also perform the Roux-en-Y gastric bypass procedure, which is the most commonly performed weight loss surgery in the United States. The procedure involves dividing the stomach and creating a small pouch, roughly the size of an egg. The small bowel is divided and attached to the new pouch. After the procedure, food moves down the esophagus into the small pouch. Then it moves on to the newly created roux limb and continues down into the small bowel. There, the food mixes with digestive enzymes from the pancreas and liver and is absorbed. The average weight loss for Roux-en-Y surgery is 70% of excess body weight. Also, the surgery improves many other conditions, such as an average 85% cure rate for type 2 diabetes, 70% reduction of high blood pressure, 80% reduction in sleep apnea, and a 95% elimination of high cholesterol. Please note that if you eat high-calorie and high-sugar foods, once they reach the small bowel, they are quickly absorbed and create a condition known as dumping syndrome. While not life-threatening, this experience is extremely unpleasant. Some people experience flu-like symptoms such as nausea, diarrhea, and stomach cramping. A third procedure performed at Missouri Bariatric Services is the vertical sleeve gastrectomy. It was designed for those patients whose BMI is greater than 60. This surgery removes a large portion of the stomach and creates a long tubular pouch with the remaining stomach. The small bowel is not divided as it is in the Roux-en-Y procedure. However, only a very small portion of insurance companies cover this procedure. So before you explore this option, please check with your insurance company to see if the vertical sleeve procedure is a covered benefit.